Hey guys, it's been a really long time since I last did a video. I'm not great at this, but still, I felt like I was just not honoring my choice to document some of these changes. Um, my face is smaller. It's been now 5 months. September 26th, 2019, I had my surgery. Today is February 10th, 2020. And it's been an ordeal, guys. I mean, I can go on for days, but maybe I do have to because it's been a while since I posted. I would say that I was hospitalized again in October for malnutrition, for dehydration. I had early signs of an ulcer. It's just been so difficult. I didn't realize my brain, that I had a fat brain, that like everything is food. Been starving pretty much. I would say that this surgery is a nice way of saying, we're going to starve you to death. Uh, I'm just being as candid as I possibly can. I'm not trying to discourage anyone. I'm not a medical doctor. I'm not a weight loss specialist, nothing like that. But it's been the hardest thing that I've ever done in my life. I'm 5 months post-op. I think September, October, November, December, January. Actually, it's not even 5 months yet. 4.5 months. And I'm down 75 pounds, guys. 75 pounds. I went from 250 to 175. I mean, you can't really see too much of it. I guess I have to stand up. I'm wearing a dress that's like way bigger than, yeah. I'm in the process of changing my clothes and my wardrobe around. There's some things that are still that I always had clothes that fit too tight anyway, so now they're fitting normally. Notice some loose skin, all this, my belly. For the most part, I feel good, but it's I'm not gonna say always, but it's a constant struggle to keep yourself hydrated and full of nutrients and food. You can't just walk out the door and say, I'll pick up something on the way. I walk out the door with cheese sticks, Gatorade, little pieces of carrots, water, and especially protein. I'm not gonna lie, like I'm just trying to be honest as possible. Maybe I'm a big baby, but I cannot do the protein shakes anymore. Like I stopped the protein shakes on a regular basis like 2 months ago. And yes, my hair has fallen out. Yes, all of this. If I could show you wads of hair that's fallen out, and it's not that I haven't been having any protein. My doctor at one point said my blood sugar was a little low, so I started drinking orange juice with the Genipro flavorless, odorless, white powder protein, which are 30 grams. So I'll get through at least one 8-ounce orange juice a day with that, and then I'll get the rest of my protein from pretty much, this is all I'm eating, is egg whites with cheese, egg white omelets, a couple of pieces of bacon here and there, chicken rice soup, Puerto Rican style, and yeah. There's not too much else I can have. I get really depressed sometimes because I don't feel like I'm part of society anymore. I can't really go out to eat. If I do, it's like, what is there to eat for me? How much could I actually get? Some things fit in my stomach, some don't. I deal with the constant gurgling and the air burps, which are constantly like coming up on me. I don't feel, haven't been able to the holidays passed me by. I feel like I'm addicted to cooking for some odd reason. I'm here cooking up a storm just to feed anyone. I fed my sorority sisters, I fed my family, I fed my friends. I've made huge pans of lasagna to give away to friends that don't have anyone to cook for them. So just so I could be around food and just see other people eating and asking them how it tastes. I also have been making sure that I am not falling into bad habits again, because I don't know, I noticed that I can have spicy Doritos, fiery spicy nacho Doritos for some reason. The sweet is not good. Savory helps me maintain. At one point, like I said, I wound up back in the hospital in November, was there for a week getting intravenous, hydration and vitamins, and working on this stomach pain, constant gurgling. My doctor says my because I haven't been back to my surgeon, because my surgeon is bogus. I was pretty much a number, I'm not gonna lie. Like, she had no type of bedside manner whatsoever. When I wound up in the hospital for the second time, it was an issue. She wanted to do an endoscopy to me again. I was telling her for weeks that I wasn't feeling right, and I knew, of course, I had just recovered. I'm recovering from major surgery, so I knew it wasn't gonna feel right. But I've been taking my vitamins, and I just couldn't get anything down. Like, it just was sips and then gurgling, like fullness so quick. My like I was saying, my PCP, my pediatrician, excuse me, my physician was telling me that maybe I might have some type of keloid or something over scarring in my stomach, because it's just so narrow. And because I had the hiatal hernia surgery as well, I'm usually a very slow healer, which I did mention to my surgeon. I wanted her to take that into consideration, but obviously she did not. The discussions that were had with her were very superficial and rushed. And I will mention her name. Her name is Dr. Marina Kurian. She's in Manhattan. Overall, I believe she's a good surgeon, but she does not have the skills necessary to do this type of surgery and deal with people's lives and their true. She doesn't have to do anything that comes with psychological and addiction, but they're not really thorough when it comes to approving you for the surgery and listening to a patient. I still have food addiction. I'm not able to eat the food, so yeah, I just dream about food all day and think about, and I'm starting to realize how often food was a part of my regimen. I just came from job-related instance that I had to go down to Manhattan for, and as soon as I got out of the meeting, I realized, usually I grab something to eat after this, because it's Manhattan. We've got such great foods, gourmet restaurants, and different types of places where I could pick up something new that I can't find in the Bronx. And I just said, nah, it's not happening. I've spent so much money on throwing away food this past couple of months. It's unbelievable, all the food that I buy and throw away. I'm constantly in supermarkets. I'm looking at food and just thinking of what I could have, and I'm afraid. I don't want it to turn into like, as soon as I can eat again, I'll be eating this again. I'm trying to go back into therapy. I'm trying to get into Food Addicts Anonymous, because I don't want to start the bad eating habits again. I already had a little piece of chocolate, noticed that, I did bring it into the bed with me, a piece of Dove chocolate, a little tiny piece, see how it feels, and it was okay. So I'm like, okay, if this is okay now, hope in a couple of months it'll be better, and I won't be going back to that type of eating again. My face looks so small, but I still have all of the wrinkles here. So guys, I just wanted to update you. I know it's been a while, like I said, and I'm really going to try really hard to keep in touch, keep posting videos, so people can understand more about what this journey is all about. And I'm not knocking it, I'm not a complainer like that, but this is the only place I can do that. So don't judge, being real. I still love food. I can't have any. I've been slowly drinking coffee again. So many things that I still cannot even stomach. So I'm pretty much just trying to keep the energy going throughout the day. The energy that I have, because I've lost 75 pounds, is wonderful, but I need the energy that it takes to function during the day and to get the protein that I need, so that my hair grows back and that I feel like I'm on a roll, that I can get back in the gym and recover all this muscle that I've lost. I've lost a lot of muscle. So in the next video, you guys, I'm hoping that I'll be more candid and be able to show you what's been going on with my body, what's been going on with my mind, what's been going on with my life, and you know, hopefully you're happy with it just like I am. A new life, you know, it's a new life, it's a new way of thinking, a new way of being altogether. And yeah, it's great to be in a size 12 versus a size 18, size large in tops instead of a 2X. Wow, this is really, really, you know, even my chain is longer. Wow, it's pretty cool. So, bon te veo, bon voyage, adios. Until next time, thank you guys. Please follow me, like, subscribe, whatever it is that you guys do on this YouTube, and peace out.